The primary survey. When a patient arrives in the emergency room, do a primary survey as soon as possible within the first 5 minutes. The ABCDE order guides you to find the more life-threatening problems first so they can be treated early in order of priority. First, check for an airway problem. Can the patient talk normally? If he can, the airway is open. If he cannot talk normally, look to see if the chest wall is moving. Listen and watch to see if there is air movement from the mouth or nose. Listen for abnormal sounds such as stridor or snoring. Look for fluid or a foreign body in the patient's mouth. In this patient's case, he is unable to swallow and control his saliva, so he needs suctioning. If there is a problem with the airway, do the head tilt chin lift to open the airway. When the airway is open, check for a breathing problem. Move the clothes to view the chest. Look, listen, and feel if the patient is breathing. Is his breathing too fast or too slow? Does the chest look normal? Is the patient working hard to breathe? Do you hear wheezing or grunting? Use your stethoscope to listen for equal breath sounds. Percuss the chest for dull or hyporesonant sounds. Now, check the oxygen saturation. The patient's oxygen saturation is 81, too low. Oxygen is started through a nasal cannula. Once you've assessed breathing and addressed any problems, move to circulation. Check for signs of external bleeding. Check for signs of shock. Are the hands cold? Feel the pulse. Is it weak? Is it very fast or very slow? Check capillary refill. Is it slow? Does it take 3 or more seconds for the color to return to normal? Then, check the patient's blood pressure. If the person shows signs of shock, check for signs of internal bleeding. If circulation is adequate and there are no signs of shock, check for a disability problem. Assess the person's level of consciousness with the ABCDE scale: alert, voice, pain, unresponsive. The patient is not alert and does not respond to voice. When given a pain stimulus, squeezing the trapezius muscle, the patient brings his arm up to stop the pain. He is given a P for responding to pain. Check the glucose level in a confused or unconscious patient. Check his pupils. Are they unusually large or small? Are they equal? If the patient is conscious, check movement and sensation in his limbs. And last, expose the patient. Examine the entire body to look for hidden injuries, rashes, bites, or other lesions. Lift the patient's clothes while respecting his privacy and keeping the patient warm. If the patient has any life-threatening signs or symptoms, immediately manage the issue. Consider the need for critical interventions. In this patient's case, an IV is placed, blood samples are taken, and an IV treatment is begun. Remember, follow the order of ABCDE to find the most life-threatening problems first. Then intervene and manage the patient quickly.